Hello there, my name is Jennifer. A year ago, I was diagnosed with osteoporosis at the age of 43. I'm 44 now, and I've spent the last year trying to learn everything I can about it and try and be as proactive as I can so that I can prevent fractures and prevent future bone loss. And I worry definitely about my later years because I'm on the younger side of this diagnosis. So I think that I got osteoporosis because I had a hysterectomy 11 years ago, a total hysterectomy. I also have a high thyroid. I have a condition that causes high thyroid, and I have severe acid reflux. And the acid reflux medications cause an issue with the calcium being able to absorb into the bones. So I've got three different components that the most likely combined or individually, I don't even know, led to an osteoporosis diagnosis. And I got that the diagnosis a year ago after I had some labs and my doctor prescribed a DEXA scan, which thank God that doctor did that because I was able to get diagnosed at a really young age. But I wanted to share with you guys what I'm doing in order to be proactive with this whole journey of increasing my bone density. So besides doing the weight-bearing exercise, that's like key to osteoporosis, is you've got to do weight-bearing exercise, really cleaning up the diet, and really kind of getting rid of a lot of the processed foods and a lot of the sugars. So I eat a low-carb, a ketogenic diet, which is a high-fat, a moderate protein, very low-carb diet, and I've been actually able to lose quite a bit of weight doing that. But I've incorporated some things that I take internally that help me. There are some vitamins that I use, and I actually use a patch for my vitamins. And I have been using some new products that I have been learning about. I am a big follower of Dr. Berg and Dr. Barrett, and just their education, and that has really helped me be proactive because, of course, I go to the doctor, but the doctor, they really kind of only know how to prescribe meds. And so even when I ask for more, what else can I do, doctor? And they say, well, we take this pill and that should be it. Well, we know that's not enough. We've got to be proactive. We've got to, help ourselves. So I watch a ton of videos, and hopefully you guys are too. One of the videos, one of the YouTube channels that I follow, it's called Natural Health Resources, and she recently, it's a doctor, and she's a just very knowledgeable gal who talked about a vitamin on her channel, and so I started using that, and so I will link everything. I'm going to go grab the stuff that I'm using so I can show you, but I'm going to link it all below so that you can see the video, so that you can see the products, and hopefully that can help you too. I have only been doing this for 1 week, so I can't say that this is all going to work, but it's just being proactive, and I'm excited to try new things. One of the components is I am now taking a osteoporosis medication called Evista. So let me grab that and I'll be right back. Hi. Okay, so let me first say that this is something I have developed on my own. I'm just trying to be proactive, but let me first show you my Patch MD. So these are the patches that I use. So here's the first one. It's just the multivitamin. There's that one, and then I also use this one, the two Patch MDs that I use the most. So thumbs up for these because these have got me some great results. Okay, that's out of the way. Now let me tell you about the osteoporosis stuff. So what I've been doing, I have three major components other than like diet and exercise. These are three things that I basically intake into my body. So the first thing is I use collagen peptides. Now this, I mentioned this to my doctor that I was taking this, and he completely dismissed it. Anything to be proactive, I'm going to do it. And so I use collagen peptide powder. I have increased my dose. I try to do 2 scoops per day, 1 in the morning, 1 in the evening. I'll put it in my tea, If I do have coffee, I'll put it in my coffee. If I make any sort of like a soup, which is pretty rare, especially now that I'm doing keto, but I used to, I'll put it in my soups. Basically anywhere I can sneak this in. I'm adding this every opportunity I have. I add this. The second thing is I follow a YouTube channel called Natural Health Resources by a doctor who mentioned this vitamin. Let me see if I can show you. I will link it below, but it is a bone strength vitamin. But the difference is this has a lot of the components, like the vitamins and minerals that we need for our body. It also, what really sold me on this is I had just watched a video from Dr. Berg, who talked about calcium, and he talked about how the calciums that we could buy like from the store, they only absorb like 10%, 5 to 10% into our bones. And then he had mentioned this other vitamin, or this other calcium, tricalcium phosphate, and he said that absorbs like 98% into our bones. So I was like, okay, I need to take calcium. So, and there's also controversy about whether or not to take calcium for this, but I'm going to do everything that I can, so I'm taking it. But and I'll link the Natural Health Resources, the referral video that convinced me to buy this product. I'll link it down below so you could take a look too. This I bought on Amazon. It was like $20. I was shocked how cheap it was. And so I'm trying it. I've only been doing this stuff for 1 week. And so I am not saying that this will work. This is just what this is my trial. Now the collagen, I've been using the collagen, for years. However, now that I'm using it, I've increased the dose. It's part of my osteoporosis plan. So every time I use this, I'm thinking in my head, I'm doing this for my bones. Where before I would kind of just do it just for health and just like the regular good uses for it. Now I use it more, therapeutically, I guess. And the other thing that I'm doing is I am now taking a pill. It's called Evista. So it's Evista. It's not like the other osteoporosis meds. This one is for postmenopausal women only. It does have that black label warning, which concerns me a little bit, but because of my age, I think I'm okay. Apparently, it can increase the risk of blood clots, stroke, and even heart attack. And I've been doing a ton of research about it, and what it does is it acts like estrogen hormone replacement, but it is not estrogen. It just acts like it does. So it's supposed to build the bone mass, the bone density. So it's supposed to do have all the benefits of estrogen without actually adding estrogen, which I cannot have estrogen in my body because the whole reason I had the hysterectomy is because of endometriosis, and estrogen feeds endometriosis. So I can't have the estrogen in my body. So we're really hoping that this med works and it helps my bone density. But one of the side effects could be weight gain. So that is major. Like, I will be watching this like crazy. I've been on a lot of forums and there are a lot of side effects with this medication. So because I'm only 1 week from when I first started it, I don't know, a lot of these side effects could happen really, really quick. It can be a lot of pain. And so I should know within the next 3 or 4 months whether or not I can continue to take this. But that is what I'm doing between the Patch MD. Now I'm taking this great bone complex. This gives me a lot of confidence. The collagen powder. I'm also doing just following the keto diet, eating my protein, keeping my nutrition strong. I just want to do everything I can to keep me well up through my 70s and my 80s. I want to be on my feet until I die, so I don't want to get hurt and be disabled or have an injury that causes some sort of permanent disability or impairment. So I want to do everything I can. So if you have any suggestions, please feel free to put them down below. I will link those 2 products below, and I will link the video where I learned about this product. So anyway, I hope that was helpful. You guys are amazing. any questions down below, and I will see you at my next video. Bye.